Is it possible to imagine that the side you sleep on can influence your health? If you have never thought about this, watch this video until the end, because you will be surprised. Sleep is a fundamental biological necessity. During sleep, the human body enters a highly organized state of physiological restoration, in which vital systems work in an integrated way to maintain internal balance and repair tissues, regulate hormones, and sustain long-term health. However, a factor that is often overlooked in this process is the position in which the body remains during sleep. The way you position yourself when lying down directly influences blood circulation, breathing, digestion, the drainage of metabolic waste, and even the way the nervous system recovers throughout the night. Many people wake up tired with a feeling of heaviness in the body, digestive discomfort, or muscle pain, without realizing that these signs may be related not only to the number of hours slept, but to the predominant sleeping position. Among the various possible positions, sleeping on the left side has attracted great interest because it presents physiological effects that are particularly favorable to the body's functioning. Throughout this video, we will clearly, thoroughly, and accessibly explore what happens inside the body when a person predominantly sleeps on the left side. If you are interested in content about sleep and preventive health, this is a good time to subscribe to the channel and continue deepening your understanding of how simple everyday choices directly influence the functioning of the human body. And before we move on, here is a question for reflection. This awareness can reveal a great deal about your own physiology. Sleep as an active physiological process. Although outwardly the body appears to be at rest during sleep, internally there is intense regulatory activity. The brain alternates between specific stages of sleep, the muscles relax in a controlled manner, breathing adjusts, the cardiovascular system slows down, and internal organs take advantage of this period to optimize their functions. Body position directly influences how these functions occur. Gravity, tissue compression, spinal alignment, and body weight distribution modify the way blood circulates, how the lungs expand, and how the digestive system organizes itself throughout the night. Sleeping on one side, in general, already promotes important differences compared to sleeping on one's back or stomach. However, the left side presents particular anatomical and physiological characteristics that make this position especially interesting from a health perspective. The impact of the left side on cardiovascular health. When a person sleeps on the left side, the heart is positioned slightly lower in relation to the rest of the body. This configuration favors venous return and reduces the resistance against which the heart needs to pump blood. From a physiological point of view, this can result in reduced cardiac effort during rest, more efficient blood circulation, better distribution of oxygen and nutrients to tissues, reduced pressure exerted on large blood vessels. In the long term, more efficient circulation during sleep contributes to maintaining balanced blood pressure and overall cardiovascular system health. It is important to emphasize that this does not mean other positions are automatically harmful, but rather that the left side offers a naturally favorable anatomical configuration for the heart during rest. Lymphatic drainage and waste elimination. The lymphatic system is responsible for removing metabolic waste, excess fluids, and byproducts of cellular metabolism. It works in a complementary manner to the circulatory system and is essential for immune function and the balance of body fluids. Sleeping on the left side favors lymphatic drainage because the body's main lymphatic duct naturally drains toward the left side. Gravity assists the transport of lymph. There is less compression of important lymphatic structures. This more efficient drainage contributes to toxin removal, reduced fluid retention, and support of the immune system. Although the body performs this process regardless of position, the left lateral position can optimize this function during sleep. If you suffer from insomnia, you wake up several times during the night and have light sleep. You feel tired upon waking. You nap too much during the day, or notice that your sleep has changed with age. The Complete Sleep Guide can be an important ally. In it, you will find guidance and techniques to reverse these situations. If you want access, click the first link below and secure yours. Digestion, gravity, and the functioning of the gastrointestinal system. Digestion does not end when a person goes to sleep. Even during sleep, the digestive system continues working on food movement, enzyme release, and nutrient absorption. Sleeping on the left side influences this process for clear anatomical reasons. The stomach is positioned so that its contents remain below the esophagus. Gravity favors the passage of food from the stomach to the small intestine. There is a lower tendency toward acid reflux. This configuration reduces episodes of heartburn, gastric discomfort, and a feeling of abdominal heaviness, especially in sensitive individuals or those who ate close to bedtime. In addition, the position favors the activity of the pancreas, which releases digestive enzymes that are important for proper digestion and nutrient absorption. Kidney function and filtration processes. The kidneys play a central role in blood filtration, toxin elimination, and regulation of fluid and electrolyte balance. During sleep, they continue working steadily. Sleeping on the left side can benefit kidney function because it improves renal blood flow. It reduces pressure on large veins responsible for returning blood to the heart. It facilitates natural filtration processes. With more efficient blood flow, the kidneys can perform their functions in a more balanced way, contributing to the maintenance of metabolic health and proper waste elimination. Brain oxygenation and neural recovery. Although the impact of body position on the brain is indirect, it is not irrelevant. More efficient blood circulation and deeper breathing favor cerebral oxygenation during sleep. This contributes to memory consolidation, maintenance of cognitive function, neural recovery, organization of sleep cycles. In addition, during sleep, the brain activates metabolic cleaning mechanisms, removing byproducts accumulated during wakefulness. A balanced physiological environment with good circulation and oxygenation indirectly favors this process. Breathing, diaphragm, and lung expansion. Sleeping on the left side can reduce the pressure exerted on the diaphragm and allow more efficient lung expansion. This promotes deeper breathing, better blood oxygenation, reduction of episodes of shallow breathing. This position can also help keep the airways more aligned, reducing the tendency to snore and contributing to a more stable breathing pattern during sleep. Metabolism, nutrient absorption, and internal balance. The combination of more efficient digestion, better circulation, balanced kidney function, and adequate lymphatic drainage creates a favorable environment for the body's overall metabolism. Sleeping on the left side can contribute to better nutrient utilization, regulation of energy production, efficient elimination of metabolic waste, maintenance of internal balance. These effects are not immediate or miraculous, but are part of a set of subtle physiological adjustments that over time influence overall health. Spine, joints, and muscular comfort. From a biomechanical point of view, sleeping on one side can be beneficial for the spine when there is proper alignment. Sleeping on the left side with the head well supported and a pillow between the knees helps to keep the spine in a neutral position, reduce pressure on the lower back, relieve tension in the hips and shoulders. The choice of pillow is essential. A pillow that is too high or too low can misalign the spine, causing cervical discomfort. Ideally, the head should remain aligned with the spine without excessive tilt. The role of routine and the body's natural adaptation. It is important to remember that the human body moves during sleep. Rarely does a person remain in the same position throughout the entire night. Even so, adopting the left side as the initial position can increase the time spent in this favorable configuration. The use of support pillows can help maintain this position for longer, offering comfort and stability without rigidity. Sleeping on the left side is not an absolute rule nor a universal solution. However, from a physiological point of view, this position offers a series of advantages related to circulation, digestion, breathing, waste drainage, and body alignment. Understanding these mechanisms allows each person to make more conscious choices about their sleep habits, respecting the particularities of their own body and seeking more efficient and restorative rest. By observing how small changes influence internal functioning, sleep ceases to be merely a period of inactivity and comes to be understood as an active process of health maintenance. And now, here is the final reflection. If a simple change in position can influence so many systems at the same time, how can you better observe the signals your body sends when you wake up every day?